Our final communication piece centers around interprofessional communication. The need for interprofessional communication, or IPC, is growing by the day. You look at this gentleman here, looks like a nice, strong guy, but there is no individual out there that is going to be able to provide and meet all of the needs that a patient comes with. So typically a patient isn't coming just for, a medical imaging examination, but they're coming for, a complete diagnostic workup at times. So in order to cater to all of our patients' needs, we as professionals need to work more as a team. So through integrated team approaches has the ability to enhance our cross-disciplinary communication to provide essentially more enhanced quality, which can improve patient outcomes and also outcomes of the healthcare delivery system. Now, each professional discipline has its own culture, philosophy, and beliefs, and these beliefs typically are ingrained early on in professional training. So, while it seems like IPC is easy to install, there's really a lot of barriers that are in place as far as how that information exchange can take place, because the way that we interpret certain things may be different. For example, here's the term healthcare. Medical imagers may interpret healthcare in one way, physicians may in another, nurses in another, radiation therapists in another, respiratory therapists in another way. So essentially, ground level ideas need to be broken down for proper interprofessional communication to take place. There's lots of kind of subsets of that word for IPC. So the one that I like best is the term transdisciplinary communication. What this involves is not just communicating with other disciplines, but essentially collaborating and integrating thoughts. There's been some successful integrations as far as the use of checklists, documentation systems. The electronic health records are great. Once we can fully intertwine PACS, that would be even better. But when different professionals can work together and essentially compile different organizational policies, if they can work together to develop comprehensive patient care plans, these things have the ability to essentially not just for us to work together, but for us to be able to improve patient care. So we're not just focusing on essentially one of their needs, but we're focusing on a collective all of their needs. To get to that point, certainly we have to get at ground level. We have a lot of technical language. We speak the language of medical imaging, and not all, certainly healthcare professionals do not all understand, medical imaging language. Nurses don't understand our talk. We don't understand their talk. So it's about breaking down those barriers, getting on the same level playing field, and then thinking about what's most important, which that is, patient care. So if we can get away from those old traditional styles and develop a respectful partnership, some outcomes that may help kind of are listed here. So, patient satisfaction, patient-centered care is of most importance, but potentially can reduce delivery costs, improve our own satisfaction in the workplace, and enhance the overall image of our healthcare system. So I want you to think about your experiences in medical imaging, and I want you to think about whether you think other professionals actually understand what we do day in and day out in terms of patient care, or in terms of just procedural delivery types of things. Do you think other professions are respectful of what we do? Are they appreciative of what we do? Do they understand the value? Are there any communication gaps that are happening in patient care because there may be misunderstanding of what we do, what we need? Think about different issues with portable examinations. Maybe the patient should be coming down to the department and you're having to do them portable. Maybe the patient isn't ready as far as they're emergency department patients and they're not prepped for their exam. Maybe it's a contrast examination and the patient wasn't informed of their different restrictions that need to take place. So there may be a lot of issues at hand that could become better solved through proper IPC. So there also may be issues with hierarchical structures. as far as organizational breakdowns. So, one profession may view themselves with more superiority than another, which could create some disciplines. So, with IPC, you have to essentially create a level playing field. All professionals need to be on the same level to make sure that the patient is getting the services that they need, and each person involved within that IPC is understanding of what goes in to that patient's plan. So if we can just solely focus on essentially the outcomes for that patient, that'll help us get on equal grounds. The textbook mentions some different things that may help in shift briefings, specifically cross-professional meetings, morning meetings that involve different disciplines, kind of touching base at a regular intervals. Can definitely help to break down barriers, but it all really ties down to communication. Face-to-face communication is something that can really help, and as opposed to electronic communication of what our needs need to be. If we can get into meetings and really start to connect, that can help. But there are some additional barriers that may impact the success of these types of approaches, such as just simply willingness. Other professions, other disciplines may not see the need to do this. The organization may not support these types of events. They may not give you the resources that are necessary for it. And there's just different types of issues that may hinder the success, and it starts with just coordinating of these types of efforts to make sure that these meetings actually happen. But they have to happen. We have to change our focus from, just simply the medical imaging focus to more of a holistic, integrated care focus. This patient, doesn't have just one need. This patient may need medical imaging, they may need respiratory, they may need lab services, may need physical therapy, occupational therapy, nursing care, all of the specialized physicians. So, for us to be able to communicate effectively between those will help to improve the patient's experience going from one area to another area. And that way, we also won't have such fragmented information going to them about what they need and do not need. So this is a traditional hierarchy in a healthcare system. You can see, of course, you have your CEO at the top. And then you have essentially all of the major players. What the textbook defines as the chief financial officer, human resources, all of our support services, the medical sector, which if you follow this over, it also includes the pharmacy managers, the pharmacists, the allied health managers, which you can see radiography falls into there. And then there's a divide here. They're saying nursing is its own block. I would actually disagree, and I would say just creating that block does create some separation between the roles of professionals. So I would say that this actually all needs to be fully integrated, and that's these are the players of IPC then. So even in RAD departments, medical imaging departments, communication needs to exist. It's not just about making sure that we're aligned in CT, that we're aligned in MR, but we need to be aligned throughout. So traditional organizational designs, I think, are very, very flawed because they may not cater to the needs of our patients. So how we can do that is to move beyond that traditional hierarchy and move towards either a flatter structure or a web-based structure. And I'm in support of a web-based structure. It helps to show the interconnectedness between disciplines. Overall, if we can just get together and we can clearly disseminate processes and procedures, that's going to help improve and ensure the continuity of care for our patients. And this is especially important within medical imaging to make sure that we are keeping pace with all the technological changes that are occurring. We have probably one of the most dynamic fields in healthcare. It's constantly evolving, and we have to keep up. And how we can keep up with each other's disciplines can happen through proper IPC as well. How communication typically takes place is by one of two channels, either informal or formal. Of course, we all understand that the grapevine does talk, where that information comes about. Can be, completely true, or it may be 100% false. So there's a lot of miscommunication that can happen, a lot of misinterpretation of information, which can create unnecessary stresses. It can decrease your job satisfaction. Maybe you're experiencing some of those types of things now, where how we get our information, is from this person knows a person who heard something through this person's cousin whose mother worked with this physician, and blah blah blah. There's a whole series of this is information is 3 sources removed type of thing. So formal communication certainly is imperative as far as proper information to come out. That way we make sure that the information is accurate and consistent. So it has to come out on a routine basis. The more IPC that we do, the more the more channels that opens up for informal communication, which can lead to more miscommunication. So, that's one thing to kind of be aware of, is that formal communication is so important, especially in technological age, where you can go from one area to another area, and an email can just be so easily misconstrued that it may just create this firestorm of uncertainty. Now, face-to-face is often the best, because you get to pick up on those important nonverbal cues as well as the verbal information. So you can kind of get the most bang for your buck in that case, to really understand the nature of things. And plus, oftentimes the face-to-face sessions do allow for that questions and answers. Electronic formatting is great, because you can get the information out immediately, rapidly to the proper channels. But if it's not detailed enough, or if it's left open-ended, it can lead to a lot of question marks. Video conferencing, I think, may be the best. I use MoveNote.com a lot for some things that we do, in the program. But I think, sites like that, where you can get the face and then you can see the presentation and get the information, are really, really important to make sure that information is disseminated to all of responsible parties, so that way everybody can understand. You get it in web format. It's not just about those day shift meetings, but the second shift, the third shift, the weekends only folks can still get the information that they need. So now, hopefully, it's becoming more clear that in order for us to provide the most comprehensive services and the best quality services to our patient, is that we have to work together in a team. We can't just simply view problems in isolation. We need the expertise and input from a variety of different professionals that may be impacting. And the more interactions that we can have, the better. Better for that patient outcomes, better for our own job satisfaction. So as we become more complex and we continue to just fly at 100 miles an hour, with technological changes that are occurring, we have to begin to work together as a team. My hope is that you start to collaborate more with those different professionals, and you start to bring up these types of things within your staff meetings about issues that may be happening in terms of communication between medical imagers and nurses, and in terms of issues that may be happening between radiation therapists and medical dosimetrists. Essentially think about some of those communication barriers that you're experiencing now, and how an IPC approach may help to eliminate some of those barriers. It's all about getting on the same page to improve healthcare delivery, to become more patient-centered.